COVID-19 is a pandemic, meaning that all the countries are affected. In every pandemic within countries, the virus will spread to every nook and corner where human beings live. In contrast with the COVID-19, cancer is perennial, slow growing yet pandemic in distribution, which affects almost every part of the country. Today, I'm going to interview my dear friend, Dr. Chinnababu, who is the Senior Robotic Surgical Oncologist and the founder CEO of Grace Cancer Foundation. Dr. Chinnababu, can we ignore cancer in view of COVID-19?
Thank you, Benny. The question is very pertinent. Can we ignore cancer in view of COVID-19? I think if we ignore cancer, the price can be very heavy because of the presentation of the cancer can be very late and the results can be very poor. So, as we all understand, we are moving away from identifying the virus in the disease towards a community testing. So, in this crucial phase, we need to be very careful with respect to any abnormal symptoms that one may have. And as most of you would know that the results of COVID are very bad in the vulnerable population. So the vulnerable population are elderly people, people with comorbid diseases like diabetes, hypertension, cardiac issues, kidney issues, and those having cancer, and especially those with immunocompromised state. So these are the ones who would have much more poorer outcomes, and the mortality rate is much higher. Hence, this is the time wherein you should not ignore or neglect any unusual symptoms that you may have, even as you have the fear of pandemic of COVID-19.
If you look at the data, the mortality rate of COVID-19 for those with cancer is around 8%, whereas for the general public, it is around 2%. Hence, there is an immense need to address cancer care during COVID-19. What are the recommendations for the general care of cancer patients during this pandemic?
Cancer patients should be informed regarding the common symptoms of COVID-19, and they also need to be trained with respect to good hand hygiene and maintaining good hygiene, especially the hand washing techniques should be taught. And they also need to be explained about social distancing, because these are the times wherein they need to avoid meeting sick people and large crowds. And most importantly, if they notice cough, dry cough especially, then fever and difficulty in breathing, they must immediately seek medical attention.
Can surgery be cancelled or delayed? Can the initiation of radiation treatment be delayed? Can radiation be interrupted or postponed if already in progress?
All cancer patients need to undergo triage, and the decisions regarding the individual case are based upon the potential harms of delaying the treatment. So, in general, cancer surgeries are a semi-emergency we can talk about, so you don't have to indefinitely postpone them. For example, if you have cases like thyroid malignancy, they can wait for about 3 to 4 weeks. For example, breast cancer, where you can think of giving a upfront chemotherapy to downstage the disease, that's where you can delay the surgery. But otherwise, in general, each case we need to decide whether the benefits of delay is much more than the harms of COVID-19. So it is an individual case-to-case decision that is made, but in general, cancer patients cannot be delayed indefinitely just because of the fear of COVID-19. Similarly, for radiotherapy, again, for those who are already begun on radiotherapy, they can continue to take the radiotherapy. And for those people who are having a disease which is more aggressive, which responds very well to radiotherapy, they must immediately start radiotherapy. In some patients, we can consider reducing the number of fractions so that the treatment duration comes down. So in general, this is advice. For those who have already started on radiation, please continue to do so. For those who require radiotherapy early, can begin even during the COVID times. For those people who require radiation for palliation, that means to say just a relief of symptoms, or those who have a low risk of advantage of radiotherapy, they can wait for some time even as the COVID pandemic comes down. So in general, cancer is a relative emergency, so we need to weigh the options of delay versus early treatment, keeping in mind the nature of the disease and also the potential harms of delay in the treatment.
Dr. Chinnababu, what is the role of faith and spirituality in healthcare?
Personally, my faith is very crucial for my practice as an oncologist. As a doctor, when I go to the operating room, I do face the fear of getting corona myself. So, faith gives me that kind of a courage to face a situation and still able to discharge my duties as an oncologist surgeon. So, without faith, I cannot operate without fear. Faith gives me the necessary courage to fearlessly walk into the operating room and then give care and hope to the patients. I can recollect stories wherein God has been of great help. So, first story goes like this. So there was a young girl who was operated for a pancreatic tumor, and the surgery went on well. But next 2 days, she developed an unusual complication wherein she was throwing out blood and she was vomiting blood, and all the medical efforts were in vain to save her. And that was the time I prayed to Jesus, and I've experienced a healing touch of God, and she's today perfectly already normal. Similarly, there was another case wherein a complicated critical surgery of esophagus, which was stuck to major structures, and I was really needing a strong courage to do the surgery. And when I prayed and looked into the Word of God, the Holy Bible, God spoke to me through Joshua chapter 1, verse 9. Be of good courage, I'll be with you wherever you go. So this gave me enough strength to go ahead and perform the surgery successfully. So in a real time, we need to depend upon God and to hold on to the hope that we have in God. So my message today to all the viewers is that you need to have hope. You need to stay home, stay calm, and this pandemic will get over soon. Have a safe stay at home.
Thank you, Dr. Chinnababu, for that amazing insight and for your sacrificial work. May God bless you abundantly. Until the COVID-19 pandemic is over, we can only hope that the consequences are not too devastating for patients, and that the oncology community and beyond are able to weather this unprecedented storm. Dear friends, have more of hope than fear. Fear will kill you even before COVID-19 hits you, but faith in God can give you the strength to journey through this COVID-19. Stay home, stay safe. God bless you all.